Hi, my name is Kathleen Lisson. I'm a certified lymphedema therapist and a board-certified massage therapist. We're here at my studio in Pacific Beach section of San Diego, and I help people after plastic surgery with a type of massage called manual lymphatic drainage. So I got my education in manual lymphatic drainage through close training. I did the first 40-hour class to become a certified manual lymphatic drainage therapist, and then I took my full 135-hour class to become a certified lymphedema therapist. So this is my video for fellow massage therapists who are looking to take kind of the same path as I am and wanting to know just some information that will help them bridge the gap from being a massage therapist to having this specialization taking care of people after plastic surgery. So I'm actually going to do two videos on this. One video is going to be my ideas on what I think that you should definitely keep an eye on and pay attention to when you go through your certified lymphedema therapist training in order to use those tools that they teach you and bring them to your post-plastic surgery client. So that will be the other video I will do. This video, I want to focus on some things that I did not know when I first opened up as a massage therapist and started helping people after plastic surgery. This is things that I've learned that will really help you to not, make mistakes or be so as confused as I was early on in the process, because I just didn't know, this lingo and these ideas that will help you kind of get this onboarding easier from being a massage therapist, getting a quality lymphatic drainage massage class that was focused on helping people with a lymphedema diagnosis, and kind of using those skills to start take clients that are after plastic surgery, like liposuction, Brazilian butt lift, facelift, tummy tuck, mommy makeover. So I have a bunch of notes here that I wrote down to make sure that I get all this information to you. So if I look down, I'm looking at the notes. So first, I'd like to talk about like legal constraints. So that's the first thing that we hear of if we're going to these MLD classes, and the CLT class is the big thing is you will not, in most states, in most cases, you will not be able to go into a hospital and be reimbursed by insurance as a certified lymphedema therapist if you are a massage therapist. So that's the one big thing that everyone has to understand before they, put down several $1,000s for this class. If your idea is that you will join the DPTs in the outpatient rehab clinic and take insurance and be able to take people through the complex decongestive therapy, in the vast majority of cases, that is not going to happen. So that's why we see more and more people who are taking this class but wanting to apply it to plastic surgery clients. So what are some things that the plastic surgery client might come in and they want you to do? The first one is that there's a big confusion out there over what is actually manual lymphatic drainage. So if you go on Instagram, and you see some post-op care providers' Instagram stories, they will show a video of them pushing fluids out of an incision, and they will call it manual lymphatic drainage. So we know that is not what we learned in class. That's not actually what manual lymphatic drainage is. If you do a PubMed search and you're looking for peer-reviewed journal articles that mention manual lymphatic drainage as an effective treatment after plastic surgery, they are talking about exactly the type of manual lymphatic drainage that we learned in our lymphedema therapy classes. That is the actual manual lymphatic drainage. Now, people are calling something that surgeons can call the milking stroke if they use it inside the OR. Some therapists called it incisional drainage. So this is done in Central and South America and in Tijuana. I'm in San Diego, so right across the border. You can get it done in Tijuana after your surgery, where they will push that serosanguinous fluid directly out of an open incision. And then if clients are having these open incisions after their surgery and they're leaking, they can go into the shower and they can do this stroke themselves to push some of that fluid out. So the fluid is serosanguinous fluid. It's from the operation. A lot of it is from when the surgeon will push this fluid into the client, and it helps the operation. It has several different, the local anesthesias in it, and it just helps the liposuction. That's how they do liposuction, is they infiltrate the area with fluid, and then they liposuction the fluid and the fat out. And that's what carries this local anesthesia, which makes liposuction, relatively painless in the first few days for the client. So that is what it is. It's drainage, but it's not lymphatic, because as we know, because we had to study the lymphatic system, it never actually enters the lymphatic system. It's interstitial fluid. So we do know that there is a case where lymphatic fluid will leak out of the skin. That's called lymphorrhea. So we will see, if you take the certified lymphedema therapist course, you will learn about lymphorrhea. So lymphorrhea is when lymphatic fluid is leaking out of the skin. And we know, if you do the PubMed search for lymphorrhea and then you see a video of people pushing fluid out of an incision, those are two completely different things. So you are not dealing with lymphatic fluid. If after the few days after the surgery, someone is pushing the fluid out, that's incisional drainage, a milking stroke. There is no real name for it. And that's why there's this confusion that people are calling it on the internet. They're calling it on Instagram. They're calling it on Facebook, manual lymphatic drainage. So we know that's not what it is. So if you get a client that's calling up and they say they're very swollen and they need drainage, and it's a few days after surgery, you have to be extremely clear with them what you do and what you don't do. So in the state of California, it's out of my scope of practice as a massage therapist to do the incisional drainage, to push fluid out of an incision. It's out of my scope of practice. It's wound care. So they can go to a wound care specialist and get their wounds cared for, but I don't do wound care as a massage therapist. So that's also, someone might also ask you as a massage therapist, can you drain my seroma with a syringe? That's not a part of my scope of practice in the state of California either. Have I seen it? Have I potentially been trained in some of these things? Like potentially, as we go to these lymphedema therapy conferences, we're seeing these wound care presentations. So I want to be very clear. It's not because we're not trained. It's because it's out of our scope of practice. And if anything happens, our malpractice insurance is not going to cover us for doing things which are not massage. Your massage insurance will only cover you if you are performing massage on someone, not if you're doing something that's out of your scope of practice. For the same reason, I can watch a bunch of YouTube videos on surgery, on how to take out a lipoma with a scalpel, but I would never expect that my massage malpractice insurance would cover me if I actually had someone lie on my massage table and took a scalpel out and did something that I saw on YouTube. Or even if I took a training course and I saw in a class how to do wound care. We both know that if I'm not wound care certified, if my insurance doesn't cover it, the insurance isn't going to cover it if someone gets an infection because I open an incision after it's closed and push the fluid out, and then afterwards that's, ripe for infection. If the person gets an infection and then they have an issue afterwards, my insurance is not going to cover for their hospital bills. So that's my really long-winded talk about incisional massage. So it's essential that we know that this is out there, that people are calling it manual lymphatic drainage, may be confused. We have to be really clear with people, with these new clients, exactly what we do and what we do not do. So that's the first thing. Great. So I did that. The second thing is MLD, a deep tissue massage, a deep pressure massage after surgery. So some surgeons do want, I have seen, since I get referrals, I ask every client that they have to have their plastic surgeon send me a referral for lymphatic massage. I have seen in the letters from the surgeons that some surgeons out of Miami will say the client needs a deep tissue massage right after surgery. So I won't do that. That's not how I practice. definitely can do a deep tissue massage. I will be covered by my insurance if I do a deep tissue massage, because I learned how to do a deep tissue massage, but I think it's contraindicated for my clients so close after surgery. I don't think the surgeon's wrong, but that's not something that I will provide for my clients. So that's the other thing, is that the clients may come in and they'll think that this massage that you're giving them is going to be very painful. And if you do manual lymphatic drainage right after surgery at 3, 4, 5 days, it should not be painful to the client. They can have soreness. They can have pain from the surgery itself. We need to ask them, are you on top of your pain medications? If you are having this breakout pain, go back to your surgeon. Have a talk with your surgeon about proper medications, but it should not be that people need to take a Percocet before they have a massage, which is what I see a lot of clients really asking and really being scared of this. And other therapists may do this. They may have a really heavy hand. But as I was taught the manual lymphatic drainage, there's a way to get the swelling out if there's no fibrosis yet, and with that very gentle MLD stroke that we learned in our lymphatic drainage training, especially if it's from one of the big 4 schools, Acoles, Close, Norton, or Vodder. Those are very good schools for a high quality education for the proper type of manual lymphatic drainage that really gets results for people after plastic surgery. And as we know, it's about the skin stretching. So we're stretching the skin. If you want to see how the close manual lymphatic drainage is, I would suggest you go to compressionguru.com website, compressionguru.com website, and you scroll down and you can see the self-MLD teaching videos from Close. You don't have to buy them. They are free. If you keep on scrolling down on that website, you will see the YouTube links, and then you can click on it and see that it's this stretching stroke. We're not going deep. We're not pressing in. We're stretching the skin, not pressing. So if the client is sensitive and they have sensitive skin, they may feel some discomfort, light discomfort with the massage, just because it's the same as if they touch their own skin. It would be very uncomfortable after the surgery, but the massage itself is not deep enough to cause pain. So we also know there's a study that has shown that manual lymphatic drainage will decrease the level of pain that the client has and increase their pain threshold from the beginning of the massage to the end of massage. And often my clients will say that it hurt more in the beginning, and then the massage itself, the strokes on the skin, are helping them to feel less pain. So let's talk about machines. So there's a lot of machines out there. So I use IASTM. I took the Graston 1 and 2 classes. I also use cupping. I took several cupping classes. So I will do lymphatic cupping. I won't leave a bruise on the client. It'll be a pumping negative compression. So both of those have indications to actually treat lymphedema. So that's why I'm confident in using both of those in treating the swelling after surgery. Do your research. You have to do your research. If a machine has no peer-reviewed studies that talk about wound healing or edema, I would be really reticent to buy that, make that investment. And you can see that there's a lot of classes out there. If you follow enough people on Instagram, you will see that some people are offering a one-day class where they're saying, pay me $2,000. It's a one-day class. I'll teach you lymphatic drainage. I'll teach you how to use all these machines. You can become a post-op expert. No one ever became an expert on anything in just one day. We know that. The initial training that I took, even just for manual lymphatic drainage therapy class, was 40 hours, and then the CLT class was 135 hours. So there's no way that you can learn all the indications, contraindications, dangers, potential situations on these machines in one day. So what I would suggest, if it's either a client or the therapist that's looking to bring this into their practice, is do some research. Start and see if you can find any peer-reviewed studies whatsoever. Things can be FDA approved, and things can be FDA approved as a heat lamp And that does not mean that it does what the product promises it does. And then make sure that you know what the product even claims to do, because many people are using things and saying that this is going to help the edema. And when you actually look at what the product purports to do, it purports to kill the fat cells. So killing fat cells is in no way reducing someone's edema. So what clients need in the first 2 weeks is manual lymphatic drainage, manual lymphatic drainage, manual lymphatic drainage. They don't need a bunch of machines, especially if those machines aren't doing what the person operating the machine tells them they're doing. Let's see, because we know that we have to reduce swelling. If we don't reduce swelling, that sets the system up to create fibrosis. That's what happens in lymphedema. That's what happens after surgery as well. The key is to use the manual lymphatic drainage teaching that we have in order to reduce the swelling, in order to reduce the eventual risk of developing fibrosis in the area. Okay, so fun fact, and this is maybe more of an eye-opener for a client that's watching this than a therapist, but you do not have to be a massage therapist to own a day spa, to own a massage therapy practice. You can open up a practice, and you don't have to have a license to do massage therapy, and you can own a massage therapy business. So this is actually the very first job I got out of massage school, was at a chain, and the chain was owned by a dentist. And the dentist was employing people to do things, but the dentist himself owned the massage franchise, and he was not a massage therapist. He had no training whatsoever. So just because you're walking into a day spa does not mean that you are being seen by someone who has the proper license and proper insurance. And then there's also a difference, at least in California, between massage therapists and estheticians. So how I first learned this is because when I was in massage school, one of our classmates was an esthetician, and she was going back to take her full massage therapy school because she wanted to be dual licensed, because she wanted to work in a spa. She worked for a very high-end spa, and she wanted to be able to do both massage therapy and aesthetics. So if you get the aesthetics license, you can massage certain areas of the body, the face, like the arms, the legs, but you can't do the full body massage. You need to go back and get your massage therapy license. So that does not mean that you will automatically find someone advertising on the internet saying that they are, licensed and saying that they're doing post-op care, and that will mean they're automatically a massage therapist. You could definitely see an esthetician that owns a day spa and is taking these extra clients because that's extra money in her pocket. But you, in order to get the license that covers you if anything happens when you're doing this full body massage, you need to be a massage therapist. Sometimes it's easier to understand if I do the opposite. So if I kind of talk about it the opposite way. So I'm a massage therapist. I'm not an esthetician. You would have to think twice before you came into this office and had me do a facial peel. I know nothing about facial peels. I'm not going to do a facial peel on you because I'm not dual licensed. I'm not an esthetician. It should be the same way with massage therapy. If someone wants a massage, they need to go to a massage therapist, not someone who just has their esthetician license. And certification. So we know I went to a Big Four school. To be a certified lymphedema therapist is a 135-hour class, and I have to take a test. But you can get certifications. You can get a whole bunch of certificates on your wall, and the certification doesn't mean anything. And people think if someone says they're certified in post-op care, that it must mean they did a rigorous training. But as I told you before, you can go and get your certification and a certificate to put on your wall that says you're certified in post-op training, and it will be a 1-day class. It will be a 2-day class. And I've taken a lot of 1- and 2-day classes, but it was always to build on the skills that I already had. And there's a lot of people on the internet that will sell you a new career in a box. If you give them $1,000 or $2,000 or $3,000, you can go, and on Friday you don't know anything about it, and by Sunday you're a post-op expert with the certificate to prove it, the certification to prove it. And that's really scary. So that's why I would certainly ask anyone, if I was a client that said they had a certification in something, how many hours was your certification? What did you learn? How many subjects and how many hours? Because the manual lymphatic drainage, the CMLDT, was 40 hours for one topic. It wasn't every topic under the sun. It was just one style of massage, 40 hours, and that certification came at the end of the class. So it really is buyer beware in this industry. So I'll just end and do a little bit, how did I get my education? Because that's a lot of what other therapists are asking. So what I did is I went to, when I first got into massage school, I was a career switch. My husband moved us across the country. I couldn't do my old career in a new state that I had expertise in. So I said, you know what, I always was interested in massage. Massage really helped me. I went to climb Mount Kilimanjaro in Africa on my 40th birthday, and to do that I had to be out in the woods climbing and hiking to train my body for 6 months for that big climb, and I would not have made it as a 39-year-old woman without regular massage. So I saw the benefits of regular massage, and it really got me interested in potentially offering this to other people. I wanted to be a sports massage therapist. And then when I actually went into massage school, I took a hydrotherapy class. I learned that there is a such thing as oncology massage. When I was 9, and my mother was diagnosed with breast cancer, you couldn't, oncology massage was not there. In fact, back then, the chemotherapy was a lot more stronger and had a lot of side effects. Exercise was discouraged, massage was discouraged. They thought it could, spread the tumor. And so to see when I'm all grown up and an adult that I can help, they can use massage therapy and oncology massage therapy to help other people who are in the same situation as my mother was in, was very close and near and dear to my heart, especially since then both my parents had passed away from cancer. So it's definitely a client base that I want to be able to reach out and help with my talents. So after massage school, I went and took the oncology massage classes, and then I learned that there was a side effect of oncology treatment, which was lymphedema. And so I said, I want to help treat people with lymphedema diagnosis as well. So I went to take the CMLDT class for close, and then I went to take the full CLT class. And then after that, it really opened my eyes to how this gentle massage can be so powerful in helping people. So I help people after plastic surgery, Brazilian butt lift, liposuction, tummy tucks, facelifts, mommy makeovers, and also at the mastectomy reconstruction phase, where they have liposuction on their abdomen and their inner thighs to do a fat transfer to the breast. And in that case, we can really help as certified lymphedema therapists, as people who know lymphatic drainage, help them with recovering from the pain and swelling in their liposuction area. And then so I've taken more classes. I took Brad Smith's class on head and neck lymphedema because I wanted to know, what can I use from that class to help incorporate and help people with facelifts. And I became a personal trainer because I wanted to know what kind of exercises could really help people after the surgery and be able to be covered with that adequate knowledge so I could talk to people, about exercise after the surgery. And so it's just been me following my passions have really brought me to this area of expertise that I feel like I can help my clients, especially if they have a cancer history, especially if they have multiple operations, especially if their operations are they had surgery outside of America, which can sometimes be quite intense. The recovery can be quite intense. And I really benefited from not only learning about the manual lymphatic drainage in the certified lymphedema therapy school, but also the compression. So I want to go into the next video where I talk about what to look at in that CLT class as a massage therapist looking to help plastic surgery clients. I want to share with you to kind of get you excited about that video, that learning about the compression was really an integral part in how I offered like a more holistic care for my clients, because I have learned about a lot of tools and the theory of how we use compression to reduce swelling, and it works. It dovetails really perfectly in with this post-plastic surgery clientele. So I really found that I use a lot of tools that I learned about in CLT school in the classes I took afterwards, and I'm applying them to my clients who are recovering from plastic surgery. So if you're excited about that video, definitely find it on my YouTube channel and check that one out too. All right, have a good day.